Hi, my name is Daniel Zetter, and I'm one of the fourth-year medical students working with the Compassion Clinic. In this video, I'm going to be talking to you about sleep apnea. We'll cover topics including what it is, how to recognize signs you might have it, how to get evaluated and treated, what complications you should look out for, and resources available to you to learn more about it. So what is sleep apnea? Sleep apnea is a disorder where your breathing intermittently stops and starts while asleep. The amount of times this happens throughout the night and the duration of it can vary between people, which means the symptoms you may experience can have a broad range. There are some different types of sleep apnea, but the majority of people affected have what is called obstructive sleep apnea, where the muscles in your throat relax while asleep and stop the flow of air while breathing. When these events occur during your sleep, it causes you to become hypoxic, which basically means that your lungs aren't receiving the oxygen that you need. It also disrupts your sleep, which can lead to you being excessively tired throughout the day. The periodic hypoxia and sleep disturbances can eventually lead to the complications of sleep apnea that we will discuss a bit later in the video. Now that we've talked a bit about what sleep apnea is, I think it's a good idea to discuss some of the signs, symptoms, and risk factors that can be associated with it that you should be on the lookout for. Many people with sleep apnea will experience some degree of daytime sleepiness. Patients may find themselves falling asleep while reading, watching television, or even, in worst case, while driving. Snoring, choking, and gasping in sleep is also commonly reported by significant others or roommates who are more able to notice these difficulties while the patient's asleep. However, while snoring is very common in patients who have sleep apnea, not all patients who snore have sleep apnea. It is important to look at all your symptoms alongside snoring to determine whether you may be at risk of having sleep apnea. Morning headaches, waking up multiple times throughout the night, increased urination during the night, dry mouth during the night or morning, and changes in mood are all less common but still important symptoms to be on the lookout for. Many patients' symptoms are brought to attention by their loved ones when they notice the gasping or snoring occurring during the night. So it's important to take their concerns into consideration and even possibly bring them into the physician's office during your meeting to discuss any concerns they may have. There are also many different risk factors that aren't a symptom of sleep apnea, but can be used in the clinical evaluation to determine how high your risk for sleep apnea is. Some of the major risk factors include older age, obesity, structural or anatomical abnormalities of your face or airway, as well as being a male. As we age, our risk for sleep apnea increases all the way up into our 60s and 70s, and males are at about a 3 times more likely rate to have sleep apnea than females. Obesity can affect your health in many different aspects, and sleep apnea happens to also be one of them. Increasing obesity is directly related to increased rates of sleep apnea. Some risk factors that less commonly are linked with sleep apnea, but are important to address with your physician, include smoking and a family history of sleep apnea. Sleep apnea is also commonly seen alongside many other health conditions, including congestive heart failure, hypertension or high blood pressure, kidney disease, type 2 diabetes, and chronic obstructive pulmonary disorder, or COPD. It is important for you and your physician to look at these symptoms, your risk factors, and comorbid conditions when determining your risk for having sleep apnea, and then potentially looking into diagnostics or treatments. Your primary care doctor is often the first physician you'll have a conversation about sleep apnea with. Involving significant others who may have witnessed your sleep symptoms and then going through a full review of your risk factors and conditions with your physician are often these first steps towards diagnosis. If you're exhibiting multiple symptoms and risk factors and no other diagnosis can explain them, your physician may recommend meeting with a sleep doctor or a sleep specialist to undergo some testing. After meeting with a sleep doctor, they may recommend some testing called a polysomnography. This is commonly called a sleep study. If you undergo a sleep study, you may be asked to stay at the hospital and undergo a full night or a split night study. Both of these will be able to diagnose sleep apnea and involve staying at the hospital for at least one entire night so that physicians can observe any sleep symptoms you may have. The difference between these two studies is that a full night study will require you to come back for one more night if you're diagnosed with sleep apnea, so that the physicians can monitor your sleep while on their treatment regimen, whereas a split night study does both the diagnosis and treatment observation over the course of one single night. Home sleep apnea testing may be an option for some patients who are at high or moderate risk for having sleep apnea, but even a negative test in this setting may require on-site monitoring to make sure the diagnosis hasn't been missed. If home testing is recommended, it will likely involve monitoring of your cardiac and respiratory parameters to check the heart and lungs using a variety of different medical devices. After any form of testing, your physician will review the results and let you know what the further treatment options or lack of treatment options may be. Many different complications can arise from long-standing sleep apnea that hasn't been treated, which this means that recognizing it and getting a diagnosis is even more important for your overall health and well-being. Motor vehicle accidents are significantly more common in patients with sleep apnea due to the excessive daytime sleepiness, which can prove to be extremely dangerous or even fatal. Other chronic complications can include worsening of cognition and depression, hypertension or high blood pressure, coronary artery disease, which can lead to heart attacks and angina, stroke, pulmonary hypertension or high blood pressure, heart failure, type 2 diabetes, and possibly even liver disease. These conditions can lead to many long-term health issues and compound into the untreated sleep apnea to decrease quality of life dramatically, which makes it all the more important to catch these symptoms early. The treatment for sleep apnea will revolve around reducing these low oxygen events while you're sleeping. This is usually done through something called positive airway pressure. This positive airway pressure maintains a higher pressure within your airways so that the airway doesn't collapse and block oxygen from flowing in while you're asleep. There are multiple different types of positive airway pressure machines, but the most common is called continuous positive airway pressure, or CPAP, which gives a constant pressure throughout the night. It is important that the CPAP machine is used consistently every night for the duration of sleeping, and your physician will likely be in close communication with you early on in treatment so that the CPAP settings and regimen can be adjusted to best serve your unique needs. Outside of positive airway pressure, there are some alternative options for your patients with mild obstructive sleep apnea, like dental appliances that may move your jaw forward to give more space within your airway, or even hold your tongue forward so that there's more space as well. This will be more comfortable for some patients, but is considered to be less effective than positive airway pressure, which means CPAP will be the likely treatment in severe or moderate cases. Some lifestyle modifications can also help improve obstructive sleep apnea symptoms. Exercise and weight loss, sleeping on your side instead of on your back or stomach, and avoiding alcohol and medications that are sedating like Xanax, Valium, or Ambien can all be helpful in improving obstructive sleep apnea symptoms in some patients. That is all I have for you, and I hope that you were able to learn a little bit about sleep apnea and have the opportunity to see a physician or family care doctor that may be able to help with any symptoms that concern you.